In the next 4 years, 44 million people around the world will die due to non-communicable diseases, and at least 1.7 million of those, depending on the estimates you use, will be right here in Africa for reasons that are both preventable and to some extent completely unknown. For instance, the prevalence of hypertension, or high blood pressure as it's more commonly known, right across Africa is the highest worldwide. It affects 46% of adults. In half of African states, though, at least 1 in 3 adults is hypertensive. And what is especially alarming about these estimates from the World Health Organization is the fact that fragile, underfunded, understaffed healthcare systems in many African states are simply incapable of dealing with the coming avalanche of non-communicable diseases, while they're still struggling to deal with basic infectious diseases like malaria. Kenya's public healthcare system, for example, it's had its doctors on strike for 3 weeks now with no resolution. Earlier on, I spoke to Dr. Abdikamal Ali Salad at the WHO as he pointed out that estimated 44 million deaths by 2020 could be an underestimate.
So these are all estimates, and it might even be higher because in Africa we still there's a lot of underreporting going on. People die and nobody knows. They say sudden death, probably heart failure or something, or stroke. People just die, and they are not, since we don't have good civil registration or vital statistics available in our countries, people bury their dead and that's it. Nobody talks about them. So this reporting is there also.
Of these 44 million, how many of those are likely to be in Africa in percentage terms?
About 4 or 5.
Right, 4 or 5%. I mean, but it still is on aggregate. That 44 million figure is still, what, 15% higher than the last estimate done by a similar study in 2010, isn't it?
Yeah, that's right. That's right.
Do you get the sense when you study this subject that perhaps a lot of healthcare providers will say, yeah, but these things you're talking about, cancer, diabetes, hypertension, these are rich country problems, for lack of a better word, and therefore they're not worth studying at a country level?
Yeah, that is true. That is the perception that every health worker has, and not only health workers, but particularly policymakers. They will say, "Oh, these are diseases of the developed world, not in a developing." But and we found out that all the risk factors for non-communicable disease are as much prevalent as in a developed country. Even worse, hypertension is the highest average or prevalence among adults is higher in even the developed world.
Indeed. Let's pull back a bit and look at this from the perspective of healthcare systems, because across Africa, most healthcare systems are still struggling with very basic problems, things like diarrhea, malaria, infectious diseases, really, things that other countries have sorted out. Public healthcare systems tend to be underfunded and they don't have the personnel they need to actually deal with these problems properly. So it sounds as though we're essentially having a situation where public healthcare systems are simply not able to deal with this coming epidemic, for lack of a better word, of non-communicable diseases.
You're absolutely right. That is why we are worried, because Africa is having what we call the double burden. On one side is communicable disease. On the other side now, as it appears, is the non-communicable disease. And the healthcare system, the health system in Africa was initially, up to now, it is still struggling with the communicable disease and also reproductive and child health services. So imagine now, the NCDs are coming, and which are chronic disease that is even more expensive to screen and treat. So that's why we are worried. So that's why we're saying there must be additional resources available, not only from the international community, but also countries must raise or must mobilize local or domestic resources to deal with this. The good thing is NCD work, the bulk of the work, like 80% of NCD prevention, it is outside the health sector. So these are things that might not need a lot of resources.